My name is Jan Klusáček, and this is a new episode of EuroHealth podcast. Our guest today is Dr. José Martínez Raga. He's Vice President of the Spanish Society of Dual Disorders. He is serving as the head of Psychiatry Department at the University Hospital, Dr. Peset of Valencia in Spain, and he also works as a lecturer at the University of Valencia Medical School. Welcome, Doctor.
Thank you very much for inviting me for this podcast. Hello.
Well, maybe we could start by explaining what actually does it mean, dual disorders.
Yes, thank you. I think this is extremely important. Well, the definition of dual disorders implies the coexistence, either simultaneously or sequentially, throughout the life cycle of the individual of two or more independent, and that's very important, the fact that they are independent disorders, but they are necessarily interacting with each other, and at least one of them is an addictive disorder. So it doesn't imply the fact of being two or more, but the fact of an interaction early in the developmental process of the subject, and the fact that it complicates the clinical situation, the prognosis, the whole situation, and therefore needs special resources and special management of the patient.
And is it a new phenomenon, or is it something that is already well established and well recognized in the research area?
Well, I mean, there is a solid base of research. I mean, across different states. However, I mean, the difficulty is how much it is actually acknowledged within the formal classifications of mental disorders. So bear in mind that although now DSM-5 and ICD-11 is tries to be more dimensional, classically psychiatric disorders have been conceptualized from a more categorical point of view. So you either have this or you have that. And that is particularly important in this concept of dual disorders. I mean, you either have an addictive disorder, or you either have depression, schizophrenia, anxiety, or whatever. The actual fact is, and this is something that is well known for I would say forever, is that 80-90% of individuals attending treatment for an addictive disorder have had another mental disorders, and vice versa. So this is the tricky issue behind it.
I think even thanks to the pandemic, so we saw a rising importance of the mental health and more attention paid to mental health in general by the policymakers in the member states and also on the EU level. So how is the situation in Spain in your view?
Yeah, well, the pandemic. The thing is, across the 27 member states, there are huge differences in how healthcare is provided, how healthcare is envisaged, and how mental health is considered. And this applies in Spain as well. I think one issue is that mental health is more in the front cover of everyone, in everyone's mind, but also in the newspapers and everywhere. And that policymakers and managers have the term mental health or the mental health as part of their discourse. And another different thing is that this actually translates in long-term planning, in applying all the resources, all the needs that are required to address this huge epidemiological, political, and societal problem.
And what about the topic of dual disorders? Is this view considered important within the Spanish policymakers?
Well, possibly here is one area where we have more done or more road advanced, partly because of the different initiatives that our society has carried out in over recent years. I mean, bear in mind that, for instance, we had our recent national conference and we had 1,300 mental health specialists attending the conference. This is for Spanish. This is a huge number. I mean, even more than the Spanish Society of Spanish Psychiatric Association. In any case, I mean, the problem in Spain, and this applies across Europe as well, is that we have two separated treatment networks: one that addresses addictions, one that addresses the rest of mental health, and this often brings the problem to the patient in that often the patient is being what we call the wrong doors effect of no, this is not where you have to go. You have to go there. No, you have to go there. The patient is in the middle of nowhere, not being provided with adequate resources. Having said that, I mean there are some initiatives in different parts of Spain of creating specific dual disorder units and programs, but still we are. Much more needs to be done, and that needs to be addressed from top down, from policymakers and then below. Yeah.
But I know that you achieved at least some success, so that you managed, your society managed to publish a joint paper with a psychiatric society on the tobacco use disorder. So maybe you could say a few words about that as well. Yeah,
but certainly, and certainly the relationship with psychiatric associations is very good. Yes, we and I was part of the board that participated in the elaboration of this white paper on smoking and in mental health and addictions. Well, it is a real problem. I mean, smoking is the most common addiction across Europe, and is the first cause of preventable death in our countries. Bear in mind that, for instance, it's probably the most important contributing factor to the fact that, for instance, schizophrenic patients have a life expectancy of 15-20 years lower than the rest of the population, and partly is due to the effects of smoking. There are some studies showing that, and for instance, the States, that 2/3 of all cigarettes are smoked by people with mental health problems. So not only the prevalence is higher, but the amount of cigarettes smoked by individuals with mental health problems is much higher than the general population, and therefore, and often the access to treatment is more difficult because, again, this is where we see this dual resources. Please first get stable of your mental disorder, and then we may talk about addictions, about tobacco sometime in the future.
Well, from the 1st of July, Spain is going to take over the presidency of the Council of the European Union. What are your expectations? I know that you are going to have general elections in July as well, so that might definitely influence the situation somewhat. But nevertheless, what do you expect from your government to push in the EU as the priority? Obviously, concerning your area of research and expertise.
Well, as you said, I mean, one of the difficulties here is that we have general elections, and the probability of some changes are quite significant. I guess my bigger hope is that we learn from the situation in probably in most European countries. I mean, if we look into the ratio of psychiatrists per 100,000 population, the ratio of psychologists, the ratio of psychiatric nurses per 100,000 population, or even the ratio of psychiatric beds, either acute beds, mid-term or long-term beds, we are in the bottom 5 in any of these indicators. So hopefully politicians can learn from the situation from other neighbor countries in favoring and increasing our human and our logistic resources that we need. However, I'm very mind also that Spain is among the top countries in terms of research in high-ranked journals. I mean, there is a lot of initiatives going on, and hopefully the position of scientific societies and the opinion of scientific societies can also be brought forward into this presidency.
We know that one topic that is most likely going to be discussed within the presidency is the approach, comprehensive approach to mental health, which was adopted by European Commission just on 7th of June. So. We know that this document is focusing on 3 guiding principles. Maybe I should just provide some context for our listeners who are not an expert like you. So 3 guiding principles: adequate and effective prevention, access to high quality and affordable mental health care and treatment, and the third one is reintegration into society after recovery. What is your point of view on this document, and what are your expectations? What are your expectations from the next steps that will mean implementation of this document?
Well, I mean, maybe a bit skeptical about all this, because I mean, this all sounds very, very promising, but these are more headlines. I mean, let's go down to practical matters, and how do all this translate into real issues. Fair enough. I mean, talking about early detection and screening, talking about psychosocial risks or improving quality of life. I mean, this is something that I cannot think of anyone disagreeing with all these principles. However, as I said, I mean, we need resources.
There is a long way from the principles to the practical steps, right?
Exactly. And bear in mind that 1 in every 4 patients attending, for instance, primary care is seeking help for mental health problems. So if we don't start from scratch, we don't start from primary care, even from schools. I mean, we need a lot of coordination with schools in terms of long-term planning and long-term prevention. But certainly, I mean, it is great that these principles are part of the EU initiative. But again, I mean, as I said, we then have to translate them into practical matters.
Well, we know the principle of subsidiarity, so maybe you can tell us what is your view, whether this area should be governed mostly by the governments, or whether there is significant added value of involvement from the EU level.
Certainly, I think the EU has a lot to influence, to do, and to say about this. I think to break all the disparities between the different European countries. For instance, I mean, one simple thing, which is the European Blue Card, which there is an initiative to be able to get the prescription done by your local doctor, your local psychiatrist in one country, in other European countries. I mean, this needs to be fully implemented, and this initiative is already going on. I think it's brilliant, actually, that talking about the global Europe, that we facilitate the EU member nationals to have access and public access to health, which is one of the basic rights of individuals.
Do you think there is sufficient understanding and respect of the interconnection between mental health issues and addiction issues? Or is it too vague concept for the Brussels bureaucrats?
Possibly. I mean, I think at the end of the day, Brussels bureaucrats or policymakers, at the end of the day, they're just residents of the European Union. And I think this, what they actually, many of their views, their perspectives are what people actually think. And for instance, I mean, one of the difficulties that face individuals with addiction and other mental health problems, therefore dual disorders, is this double stigma. So they are only not discriminated, for having depression, having schizophrenia, but also they are being discriminated because they have an addiction. And addictions in many parts of our society are still not viewed as mental health problems, a brain disease, as they are. And if you don't break all these prejudices and misconceptions, you're not able to move forward and actually do formal planning and formal prevention and formal treatment for patients, which is what they are.
What is the one measure that you would implement if you became EU dictator and could just change one thing? So would that be, I mean, regarding mental health and addiction, of course?
Good question, actually. I mean, the first thing I think is there are some basic things which is are not costly, which is to incorporate addictions and mental health within the same treatment network. It doesn't make any sense that patients go to different. I mean, in some countries like the UK, they were envisaged as a subspecialty of psychiatry, and this is actually the one line of work that, for whatever reasons, was not followed. And so the same way that you go to eating disorders, and you go to psychosis clinic or to ADHD clinic, within psychiatry, you could go to addiction clinics. So this would solve a lot of things. If I was a dictator, though, I mean, certainly what I would probably do is to shift all the budget that is done to weapon and armamentum to health. But this is so fantastically thinking that probably will never done. But certainly, I think considering the proportion, I mean, how the impact of mental health problems, both in the burden of disease, in the impact on the daily life of the individual, and on the high prevalence of mental health problems. As I said, I mean, 1 in every 4 Europeans will have a mental health problem in their lifetime. So certainly the resources need to be in accordance with this large amount of mental health problems. And not consider the Cinderella of health, which it still is.
Do you think that there is some best practice that we all could learn from Spain? Is there something that you are doing really the best in EU concerning, once again, this area?
Well, I guess in along this aspect, I think there are many different initiatives across Europe, and I think the important thing about health overall and mental health in particular is that we consider evidence-based approaches. I mean, we cannot think of what this is what I thought today, or being influenced by what's trendy. Data are there. Medicine is science. It's not like mathematics and exact science, but it is science. So we need to implement our practice based on data and on science, considering the psychological, the sociological, and the biological elements that are part of mental health problems, the biopsychosocial model. This is one of the fights that I think the scientific societies in Spain, at least most of them, are trying to to put forward. I mean, there is both the Spanish Psychiatric Association, our Spanish Society of Dual Disorders. This is our main weapon to try to raise awareness about the importance of not considering mental health problems differently to any other disease in our body. The brain gets sick like any other parts of our brain, and unless we consider that, I mean, we always see mental health problems as different, and we'll stay with this discrimination towards mental health problems.
Well, I think this is really brilliant answer to my question, because this should be probably applied to other areas of policy making, not just mental health and addictions, right? Well, my obvious question is, while we are awaiting the start of Spanish presidency, so do you personally intend to take part in the presidency activities, or do you intend to join the discussions, contribute to the discussions that will be held at the EU level?
If I'm invited, of course. I mean, I think as part of our society, scientific societies, we believe we should, and we are generally invited to take part of this discussion. I think that any professional, and especially those that we have some responsibility level, we should be actively involved in any policy planning at the local, regional, national, or European level. This is hugely important.
Okay, great. Dr. José Martínez Raga, thank you so much for your time.
Thank you very much. It's been a pleasure, and I really enjoyed the time with you. Thank you.
Thank you.